I am Dr. Devdutt Thomas, practicing at Siloam Thomas Eye Hospital, Coimbatore. I would like to give an awareness about glaucoma, which is observed every year in the second week of March. So this year we are observing World Glaucoma Week between the 7th of March till 13th of March. So I would like to briefly say that glaucoma is one of the leading cause of blindness in our country, and there's a prevalence of 7% of patients in our country affected with glaucoma. 12 million people are affected with glaucoma, out of which 1.2 million are blind. So glaucoma is a multifactorial disease which is produced by the raised intraocular pressure. As we can see here, the eye is like a globe shaped structure, and the reason for it is being the eye is maintained as an eyeball because of the fluid inside the eye. So the fluid inside the eye is responsible for giving a perfect round shape to the eye. So when the fluid increases, the fluid pressure increases, it produces a lot of changes, and the pressure gets affected onto the back of the eye, and this produces a damage to the optic nerve. So this produces the loss of peripheral field of vision. So patient slowly starts having a peripheral narrowing of visual field. So the eye pressure inside increases and produces this damage of the retina. So the patients with glaucoma slowly, without their own knowledge, lose their peripheral field of vision. So the patients who are all requiring the screening for glaucoma are patients above the age of 40 years, patients affected with diabetes, patients affected with hypertension, patients with a family history of glaucoma, and these patients have to be checked up for their eye pressures. So we check the eye pressure with the help of an instrument which is called as tonometer. This is an applanation tonometer. So the edge of this tonometer touches the eyeball, and then it gives a pressure in the form of a reading here. So this is the way of checking the intraocular pressure. So if the pressure is very high, it slowly damages the optic nerve. So there are very different ways of checking the eye in detail. The detailed checking up of the eyes includes the checking up of the intraocular pressure, then recording of the changes in the optic nerve by doing a dilated fundus examination, and ultimately the patient is subjected to checking up of the visual fields. We should all remember that our area of the field of view is a very broad area of field of view. So in a glaucoma patient, because of the raised eye pressure and the damage to the optic nerve, the field of vision slowly narrows down for the patient. So that is indicated in this patient file, where the patient 5 years back when he came to us, he had a normal visual field. The entire visual field of 30 degrees did not have any areas of defects. As the patient has not come back for follow-up, he has developed glaucoma, and this normal field has been affected, and he has got a narrowing of the upper half of the visual field. So this is the patient who has glaucoma, advanced glaucoma. So once this visual field is damaged, the patient does not regain back this visual field. He has lost this visual field permanently. So the patient undergoes a gradual deterioration of the visual field over the years, and if it is not detected early, the patient will land up with blindness. So ultimately the patient will have narrow tubular vision. So this is the danger of glaucoma. Because it's a silent disease, the patient does not know that it's a very serious condition. So every patient after the age of 40 years should have the recording of the intraocular pressure, then detailed examination of the optic nerve, and if there's a suspicion, they should undergo visual field evaluation. And then once it is detected, we can arrest the stage of progression by giving anti-glaucoma eye drops and medications. And with the medications every 1 year or every 6 months, the patient has to come back for a review. So this is the most important condition. So it's a silent sneak thief of vision which is produced by the gradual increase in the intraocular pressure. Thank you.